Know my story. Let me just quickly update you if this is the first time that you're listening. In 2021, I had a resurgence of Lyme after an exposure to spike proteins and COVID and
Mold
and Wi-Fi, just kind of adding to the toxin bucket at an already stressful time. And unfortunately, it affected my heart in a bad way. My lymphatics, it turned on about 7 or 8 different Lyme and Lyme co-infections. If you don't know what Lyme co-infections is, they are infections that come along with and complicate Lyme disease. And they're often also contracted through bug bites, but they can be caught through an intimate partner. In utero, mosquitoes are shown now to carry them, and other vectors like spiders. So it's not
bed bugs.
And possibly bed bugs. Also, these can be present in your mouth or mucosa, and things like dry socket. It can gain access to your bloodstream, where they can wreak havoc and spread through your whole body, creating trillions in a second. And they can embed in, they love joints and eating your hyaluronic acid. They can create a lot of pain, a lot of waste, and a lot of symptoms that jump all over the body. And if you're having symptoms like that, you most likely have some sort of co-infection or opportunistic infection or Lyme, or a combination like I did. There can be mold that complicates it, and
Makes it way
other
worse.
things like candida that are opportunistic can become infectious, and it's kind of then shuts down your immune system, and it creates this huge chronic inflammatory response in the body, an excess of histamine and excess of cytokines that are in our body for a reason, but they're overreactive, and it is very, very traumatizing for your overall health because it's terrifying. It's poorly understood. It is gaslit a lot of the time medically. Even being in this field of functional medicine, they were able to make me feel silly and stupid when I was concerned that I had myocarditis or pericarditis, which turned out to be most likely Lyme carditis based on the numbers that came up. And Leah was here along with me, and we did a whole podcast on it already, about how manual therapy can help, and all of the other therapies that she came with me to every appointment and did alongside of me and learned about alongside of me. But there were the daily things that people can't get past, so then they can't get through their protocol because it's called a herx, or die off symptoms. As you're trying to kill something, it kind of can overload the system. So there's always the basics that we try to work on, such as drainage, but even some people who are really chronically sick, when you start draining them,
which seems like the most basic step,
it flares them.
Flare.
Things get stuck. There's traffic jams. So we've learned a lot about clearing lymphatics at their exit points, which we have other videos for. So maybe in the notes we can add those. But today we're going to try and do a good job at covering a symptom that can be part of a herx, and what you can do in that moment to try and get past it, to not have to go to the ER.
Yeah.
Because, usually they're going to calm down, but your whole nervous system goes into just overdrive, because you are overreacting to stimuli, but also these are very real stimuli. When I say that, is not that you're not having the symptoms, it's just you can taper them down by understanding them, by having someone that you can talk to about them, that isn't judging you, that is listening, that can also try to help you troubleshoot.
And then the right support.
And then the right support products. So, I'm going to say this right now, when it comes to like the clinic that we have is called the Vagus Clinic. And we know the vagus nerve is important, but literally when you're in these states, like sometimes, you can't just think your way out of them. It's not that type of thing. We need some help. Okay. So we're going to talk about what helps. So let's start with the heart stuff.
One more thing, because I know people are always like, well, don't chase symptoms or whatever. It's like, if you're having that bad of a reaction to something, you need to calm that symptom down. Like
We call it
you
managing symptoms.
get to the root cause by doing the other things, but you're never going to get to that root cause if you don't help manage your symptoms along
You
the way.
can't start killing it. So managing symptoms, the way that we're telling you, is actually lowering your toxic load. So
Yeah.
you're actually getting to the bottom line. These are not masking them. We're never trying to
Right.
mask them. So just so that's clear. So for instance, okay, so let's start with heart. So my heart starts beating fast. I feel the extra beats, or I feel like the pressure in my left breast or my boobs, the fullness,
Tightness.
yeah. The first thing I do is I take a binder that I've known works for me. If you're just starting off and you can't handle a binder, I'm telling you, you have to figure out what binder works for you. I'm going to try to rhyme through all of them without missing any of them, the ones that we use. Toxiprevent, which is an extract of zeolite clay. You can use a full zeolite. You can do chlorella works really well for some people, or starting off more gentle like spirulina. My favorite binders are humic and fulvic acid. So there's the Cellcore binders, there's Viorad Chem, there's biotoxin binder, there's carboxy, there is HMET binder. They all have different roles, but one might work better for you. You have to be willing to try. We give people samples because I always have them open because I'm using everything that I tell you about. There's also GI Detox, which is a more broad spectrum binder. There's charcoal, which is an acute binder that might be the one that works for you. I had a guy that couldn't take anything else and he could take charcoal. Now, charcoal is not as active as a binder and it's going to bind up some good stuff, but it doesn't matter. You're going to start microdosing binders first, a small amount, and you work up, because even a full capsule sometimes can be too much because it will start to grab onto toxins and pull toxins, and then you'll be overloaded again. So, but we need to find a binder that has to be something that you have on your plate, or glutathione helps for some people.
Yeah, I mean, there's so many different types of binders, and the one thing that Steph can attest to is like there were certain points where certain binders worked really well for her, and then there was other times where that binder did nothing, and then she was kind of like, okay, now what do I need to replace that with? Because at different points your body's going to need different things, and it's going to need to be binding different things as you're working through your case. So if something stops working for you, it's not panic mode. It's like, okay, how do I pivot and now figure out what's going to be the next thing that I need to be taking that's now going to be working for me.
Yeah.
So you've worked through all of the, like the reason she's listing all those binders is because at some point she's taken all those binders.
Yeah, and I've taken combinations of them.
And combinations of them, and yeah.
So in short, once so say you're already on a binder and now you're getting this, you take the strongest binder that you can handle at that time, and you don't be scared to take it again in 20 minutes. When I was flying home, because this happened to my heart when I was away, I took one every hour.
To get home, because it was like a 5.5 hour flight.
Yeah. Okay. The other thing that helped my heart a lot was ginger. So we have our own ginger from Vegas Clinic. This one's really hard to get, but it's also a great one, but they're very similar. They have rosemary and ginger. Ginger is anti-inflammatory. This helped really well for me. I know some people are allergic to ginger. Obviously, that's not going to be one that you take, but there's curcumin, there's liposomal C can bring down inflammation, there's glutathione. So I would do one of those things with a binder
to bring down,
and then I would do hawthorn berry. So unfortunately, they have canceled in Canada the concentration of hawthorn berry that is the most effective. And it's isolated from hawthorn berry and not mixed with the leaves. And it's a 1 to 2 concentration that is now unavailable to Canadians. So, you know, we always try and find ways of still sourcing these things. But if you're in the States, you can still get it. But if your practitioner uses standard process, in Canada, it's called MediHerb. St. Francis has one that has, but you're going to have to dose higher, but hawthorn was very helpful. If my heart sped a lot and it was pounding, I would use motherwort.
Yeah, you did use that.
It tastes disgusting, and I didn't use that much because
you didn't use it that much.
But that is one thing that can help acutely. The other thing, but hawthorn was very helpful for me, so I'm very sad about that. And then these saved me, slowed down, calms you down, right? It helps your nervous system, but it helps calcium regulation. A big problem that happens with Lyme, mold, even all the EMFs is that you get this dysregulation of calcium. Too much influx to the cell gets damaged, calcium drips out, calcium overload, your body does anything to get rid of it.
And all of our like muscle contraction is based off of calcium. So you
And-
gotta
and-
think about it. Smooth muscle, skeletal muscle, all of it is based off of the movement of calcium. So if calcium is dysregulated, then you're gonna start getting these heart symptoms.
So even when you have a heart attack or if you have tachycardia or something, they put you on a beta blocker. A beta blocker is a calcium channel blocker. And so this also regulates calcium from like a cellular level. It can regulate calcium in your gut. And so it has a component that's the way it's calming, because GABA that you take orally does not cross the blood-brain barrier necessarily, and it's still extremely calming. So people think you have to do liposomal, but I'll tell you, I've done liposomal and I've done these chewables and they help me. And I'm not saying the chewable's the best. It's got some stevia. It's definitely not perfect, but it's in a bind when you need something to absorb quickly. This is going to be
Insanely.
insanely helpful. So this is only 100 milligrams per tablet, but I would take up to 5 a day, but you can take up to 7 or 8 if you really need it. The
So
other thing,
sometimes you would take, just to kind of summarize that, sometimes it would be like starting to feel like stress, pressure in your chest, heart symptoms, anxiety symptoms, taking a binder, you maybe taking something anti-inflammatory like the ginger, and then taking a GABA all at the same
and a
time.
hawthorn.
And a hawthorn. If it was really bad. Sometimes it's just binder and a GABA.
Yeah,
Because
and
it's
then-
not that bad.
And then if Leah wasn't here to help like treat me and open up here, because, or Nathan, my husband, you have to have support in this. So,
Yeah.
Your lymphatics, we have videos, but that clears above here. This is a big place for it to get stuck. If you know what I'm talking about, you've gotten that ache there. You could feel your boob increase pressure. Even men are feeling that. Your nipple feels a little tingly. It's filling up because it's not clearing down where it's supposed to. So this toxic overload, if you can
It's building up.
massage and open these up, even if you don't have, because we have multiple different creams. Again, we have videos on this already, but I guess repetition is key. Oh, yeah. We have Itiris, which is this homeopathic lymph moving cream, immuno cream, which actually tags stuff under the skin so your immune system can clear it out. There's usually an immune system problem with this. And then there's castor oil. So you would see me with different things. Like I would take a thyroid pack and put one on each exit. So I would take the castor oil, put it on. If it felt really blocked, I would add some breast oil to it. And I would have them sit there while I like massaged around it. Or I'd put these ones on first and massage, and then do a pack after. So some people don't know what packs are. I need a new one anyway, so I'll open this.
And think about like anytime you're getting heart symptoms, like your lymphatic drainage points, like where everything has to exit is right under your collarbones. So if these points are clogged and not open and not draining, everything is just filling up here. So this congestion is just adding to that like anxiety and pressure feeling that you're getting, and then that gives you more anxiety and stress and pressure.
And you'll feel, if you feel closely, your lymph nodes feel engorged a little bit, right? So also the vagus nerve sits right here. And so here is where all the waste has to go in and re-enter your circulation once it clears out from your lymph and your fascia and like your extracellular matrix that's like around the cells. And then there's like a physical traffic jam, like not enough waste can get through of all the carcasses of, even though they're microscopic, they build up. And then that waste creates pressure that puts physical pressure on the heart. So if you've had a lot of stuff ruled out for your heart and you're still having heart problems, this is probably what's going on.
Something that needs to be addressed.
So you just take castor oil and you could even use this is a kid's pack and put it at both sides and have it over your chest. They now have like breast ones. So you can put it into your breast and like even have it up there. But castor oil is very anti-inflammatory. It moves smooth muscle. It helps open up the lymph. And it's pretty magical
and it's like very safe.
It's definitely safe topically and you can use it liberally. Say my biggest go-tos. Okay, yeah. This. So my blood pressure goes high. That's what happens when your blood's pumping really high. Your body's trying to clear stuff out. There's a traffic jam. It's like, come on, like, let's get this moving. Your blood pressure is going to go up. That's going to stress your kidneys, make your kidneys more sore, all of that. So for me, this was a lifesaver. This increases nitric oxide, would help to like expand those vessels so they're not in that contracted state and help lower your blood pressure. if you suffer with like orthostatic hypotension or anything like that, it's probably not for you, although
Mhm.
I mean, it could be, it's just, you would have to work with someone. But this is just a mix of potassium because like your calcium's high, calcium potassium pump, you got to pump up your potassium. And that helps lower blood pressure. And then there's nitrates in it from beets. And that helps to build nitric oxide, but not the toxic nitric oxide. Like there's a difference between when nitric oxide can be toxic, and that's more when you're using precursors like citrulline and arginine, but you don't have enough of a certain enzyme that's going to create the end product, so you get too much waste, which is called peroxynitrite. So just to get clear, nitric oxide is protective when you take it in a nitrate form instead of trying to take it in a precursor when you're lacking a certain enzyme, which as you age, that gets lower. Younger people and people that are working out at the gym or they're using it because they're already healthy, arginine and citrulline can be great for them. So, but if you're sick, you're most likely want to stay away from those amino acids. So
Yeah.
even for Leah, this helps her a lot with headaches.
If I get a headache, and I don't get them often, but if I do feel like I'm getting a headache, I feel like this is like a lifesaver.
Sorry, it's also high in B1, which is calming for the nervous system and can cross the blood-brain barrier and help with regulating the blood flow. So if it's too high, it doesn't make it higher, but then it increases blood flow if you need it. So anyways, there's lots of benefits to B1 as far as like supporting the vagus nerve and everything too. I mean, other than that, like red light. So flex beam is something that helps a lot. I have another red light panel. Any red light helps. The reason I talk about flex beam a lot is because I'm about convenience, and when you're sick and you have a million things that are easier to bring with you and travel with. So it's pretty simple. You can turn it on. There's 3 levels. 1, 2 is organs, and then you press play, and then this was just on my chest. You can put it
All
on
the
your
time.
back. You want it right on the skin. When you have something black, it's still going to absorb it, but I mean, on the skin is definitely better. Again, even some people react to red light. I was luckily, it was really helpful. Like people that we have that are really sick. Ooh, let's leave this on. That are really sick. We had a person that reacted, but she slowly built up and then it helped her. But what happens is it activates your mitochondria. And your mitochondria then become detoxing. And when you're already toxic and you're not clearing, then you're going to feel funny and you're going to have to use more binders and more clearing of your lymphatics.
The other reason that this red light is good is because it's battery powered. So like you charge the battery and then you use it on you. So you're not it's not plugged into a wall while you're using it.
Yeah. So then you get more EMF and then it dysregulates your calcium even more.
So it's quite helpful.
The immunocream was a lifesaver for me. It has something called GC-MAF in it, helps move your lymph, but it also, like I said, tags certain bugs. So yeah, these topicals were really important, but keep in mind, I had a whole protocol that I was also doing. And one of those important things and things I would take more of on those days was also added liver support, because when your liver isn't draining, your liver, I actually just learned this, when you're unwell and your liver's feeling blocked, it's trying to flush itself and it creates like more lymph because most of your lymph is made in your liver. And then you actually like gain this extra few pounds of puffy inflammation, which is extra
Makes a lot of
lymph.
sense. Yeah.
So if you can get that liver draining, so the other thing you can do is
Liver pack.
Yep. This is a kid's pack, so the liver packs usually, but you would just put the castor oil, like I showed you, you would dump it on here, and then you put it over your liver. Your liver's on your right side under your ribs if you have Lyme.
And
or
also
any
when
of
you're
these
using
things.
this, put it on the like cloth side,
Cloth
not
side.
the like
Cloth side on your
side.
skin, and you want to make sure your pack is always organic. We use Queen of Thrones. I started getting into some homeopathics and stuff too, like the histaminicum helped me a lot. I used the chamomilla a lot for calming. And then just based on my symptoms, sometimes I would be into this pack that I have of just like the basic homeopathics, but I don't want to get too much. I think that that's
The only other
helpful.
thing I think and I mean, you didn't always do this, but like even a sauna could be helpful.
Oh my
But that
gosh,
can
that's a
also
huge help, a huge
trigger some
help.
people. So you have to be, we had,
Honestly, but try, I think it's worth a try.
it's worth a try, but we know people who have,
Yeah.
depends on the person. So some people
But if you
react
can
to it.
handle being heated up, then I mean that just helped for pain and organs and
Yeah.
flushing. So
So
100%
infrared.
infrared.
Sauna.
Infrared sauna, I mean, if you can't infrared sauna, obviously a sauna is fine, but even in a sauna with like a red light on like this,
Mhm.
but yeah, there's affordable saunas. Like there's the sauna blankets.
Yeah, for sure.
I have a higher dose one.
Yeah, so do I.
So do you.
They have the tent ones too. The tented.
Yeah, so the
Like
sauna space is my right now my favorite. I just interviewed him and he was just like a breath of fresh air. And I mean all the sauna people are because they know. Therasage is
Mhm.
the sit-in one. But all of these doesn't matter, whichever one of them, they all help me.
They all help.
So yeah, it's getting energy to the cells and then
I think the only other
breathing.
thing, oh yeah, breathing.
Breath work.
But the only other thing I was gonna say other than the sauna was you did do a lot of baths.
Yeah. I'd put magnesium in them because I couldn't. Oh, I sprayed my body
Sprayed
with magnesium.
magnesium.
I couldn't take oral magnesium for a while. It would stimulate my symptoms worse, and the more research I dove into, it can feed some pathogenic bacteria. And I definitely tried to do it to calm myself down when I was on the flight when a lot of this turned on, and it was
So
very
topical
detrimental.
magnesium,
So
spraying it or
yeah,
then in a bath.
topical magnesium, I was just loading that on my body and on magnesium oil on the bottom of my feet at one point when all I had was oil. I didn't have the spray yet. Funny enough, King Coffee helped me a lot, but that has reishi
Mushrooms.
mushroom spores in it. So these are some things that you can consider for Herxine. So think about upregulating drainage, supporting the liver. Think about supporting the lymphatics, massaging the actual lymphatics. Have some sort of health hack, be it a red light or a sauna. Those would be probably our
Something.
top two. Oxygen is a big one too, but that's a whole other thing. We could do an oxygen podcast.
Bind a binder that works for you
Huge.
to bind.
You need a binder.
And then something like obviously anti-inflammatory
For your heart,
calming.
especially like Hawthorn, yeah, calming. If GABA doesn't work for you, there's L-theanine. If L-theanine doesn't work for you, there's blended other products. There's
Relax Max.
There's like even if you do handle magnesium,
Even
that's
magnesium,
gonna
I was
help
gonna
you.
say, yeah.
B6 can be calming for some people. You know, I'm missing a ton, but there's like blended
There's a lot
products
of
like
options.
catechol that
Yeah.
has like a blend of like herbs that are relaxing and a blend of herbs and amino acids, like a kind of blend. There's so many companies that have blends. It's one of the most common things that people, so you can find what works for you. We have one that's a blend of GABA and L-theanine called the liposomal GABA, which helps some people more than the chewables, but the chewables help me more. So playing around and actually like paying attention to your body, getting
That's
some
probably the biggest thing.
interoception, making sure you're also pooping, breathing, sweating, get this stuff out.
Those are the biggest ones.
Okay, I hope that was helpful. Tune back in. Thanks for being here.
Bye.